Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. It's a pleasure to be back with you again tonight. I'm your host, Dr. Bernard Fialkoff, welcoming you back into that special space where you get a chance to communicate with the leaders that we have internationally who are changing our world for the better, presenting new technologies, new advances. And many of you have been asking, how do I avail myself of all the previous episodes? It's very simple. Go to YouTube, click on A Time for Truth show, hit the subscribe button. You'll be one of our members. There's no fee. And you can join this group that's bringing truth, bringing future to our world. You know, our world is suffering from a lack of confidence and trust. All of the surveys, so much of the media keeps propounding and expounding on this very fact. And if you look at the wars, you look at the conflicts going on globally, we realize the importance of trust, of honesty, of integrity. And tonight, we're very lucky to have with us such a leader all the way from California, a special doctor, not just a doctor of teeth and gums and smiles, but a doctor of community and a doctor of heart and integrity. And Buddha, let's put up his pictures up on the screen as we introduce Dr. Amir Jamsheed. And there you go, who from a very young age saw something that many people overlooked. He didn't see just teeth, but he saw the power behind a smile. While others just glanced, moved on, like many movies show people rushing by, he actually paused and took his time to study and actually imagine how each smile could be brighter, could be happier, more confident, more alive. And his curiosity grew into his lifelong passion. There you see him lecturing. As he matured, so did his understanding that the oral cavity, the mouth, is not separate from the body, but a gateway, a pathway to overall body health, confidence, and quality of life. He was determined to master both the science and the artistry behind dentistry. He pursued his education at UCLA, earning his degree in biochemistry, and then advanced to the USC School of Dentistry, where he graduated as a dental surgeon in 2006. But for Dr. Jamsheed, dentistry was not ever about degrees. It was about the impact he could create for his patients and community. With his vision to redefine patient care and elevate that experience, he founded Encino Dental Studio in 2012, and then Whittier Studio in 2024. And through his practices, built more than just clinics. He's created environments where patients feel heard, understood, and transformed. He continues to do what first inspired him as a child: change lives, one person at a time, one smile at a time. For him, each patient is an opportunity to help, to create community and spread happiness. Because in his world, a smile is not just an expression, it's a powerful force that changes everything. And there you see him lecturing at one of my friends' events, MGE, with Louis Cologne, one of my good friends who does so much for dentistry. And Buddha, if you will, let's bring up live Dr. Amir Jamsheed to A Time for Truth show. How are you, Doc?
Hi, Dr. Fialkoff. How are you?
I'm doing well. How is it in California?
It's pretty good right now. Pretty good. Thank you so much for that beautiful introduction.
It's very difficult not to do such a beautiful introduction when you have so much to work with. You know, an artist always says, it's only what I have to work with, and you make a very good subject. So thank you for all you do.
Thank you. Thank you.
Absolutely. So let's get right to it, because I know you have so much to share. And a person like you is really an example of what the world needs right now, this crisis of war, global conflict, with the technology we have, the disastrous consequences the world war would bring. You said your journey began with a fascination for smiles. I'm curious, because now so many years have passed by, how has that curiosity of yours shaped your dental philosophy of today?
So it's what really intrigued me about dentistry and just my journey started was when I was a child. I hit my face to the floor playing dodgeball, and I ended up breaking one of my teeth. And I was so like distraught that, hey, how am I gonna go to school tomorrow? I have a missing tooth. I'm only like 10 or 11 years old. And my dad took me to this dentist that stayed late that night, and he fixed it for me around like 8 p.m., 9 p.m., and put the smile back together for me, and gave me confidence again. And it's very important to me to give that back to my patients, to my friends, and whoever that comes in to my office. Whoever reaches to us, we try to see them the soonest we can to get that pain or to that get that lack of confidence out, and create that fascination for them. Put the smile back on them, the true smile, the one that when they smile you can see their soul smiling. That makes me very happy.
Makes a lot of sense. And you know, you're founder of two dental offices, Encino Dental Studio, Whittier Dental Studio. What are the core values that you instill in those practices with your staff that reflect this philosophy that you want to, get out to the world?
So there's two very important philosophies that I have, and one of them is to make sure the staff that I take on and they come to help me, they feel like they don't feel like they're going to work. They feel like they're coming to their second home, and we all have fun. We always try to hit our goal. And last month, for example, we all went to sushi, and I counted it was 30 of us, and we had a blast. So it's very important people feel like they're coming to their home as to work, and that transpires to the patients, because when patients see that, they feel comfortable coming there. And so the first one is for patients to for staff to feel very comfortable and have a very positive tone when they're in the office. And the second is that transpiring to the patients, and patients feeling the happiness when they come in. A lot of them tell us when they come there, they don't even feel like they're going to a dental office, because, as you know, I mean, going to your dentist and going to DMV are about the same as far as I gotta go to my DM, get my driver's license renewed, or go see my dentist. It's gonna be painful. But we have that. We are creating something that takes that away, takes that stress away, and it makes it a lot easier for people to send us their family members when they see, hey, we're just part of them. We're just part of their family.
Makes absolutely sense. I know that in my practice as a periodontal surgeon, implant surgeon, absolutely, it's the same thing. What you have to first do is get them to relax. Once they're relaxed, everything just flows more smoothly. And you're so right. You change much more than their smile. You actually change that human being because they see that they can trust you in your, in Encino and Whittier. And that's a beautiful thing and beautiful feeling. So since I know your staff will probably watch this, I want to actually congratulate your staff. I'm going to give you this a round of applause. And you know what? Next time, I'm going to be very upset if you don't invite me to your dinner, because I'd like to be with your staff. I'm talking to the staff. Actually,
you will be invited.
I'm not upset with the doctor. I'm actually talking to the staff. So because I know you're a good guy, I can see that. And that's just teasing them to rib them a little bit, because I know they probably do that with you. So let me go on to the next question. Is many patients, I know this in my own practice, come in, they're terrified. They're not talking. They're kind of like little kids, even though they're like 50, 60, 40, whatever they are. And how is it that not only do you restore their smiles, but how do you go about restoring that confidence and sense of self and comfort that you do?
It's just communicating with them, Doc. We communicate very well with them. We hear them out. We see what they're trying to accomplish. We give them the data they need in order to, have a long-lasting smile. And when they look into it and they understand that we're genuine and we want what's best for them, they listen. They follow the advice. They'll make the money part work. They and we and us on our part, we provide the solution that we would definitely provide from our own staff or our own family members. So we're like, this is what you need to do, and they go with it. If there's any way possible, they'll do it.
That's beautiful. So I wanted to ask you a question, because I know you're very community oriented, as your wife is. In a time where our country is beset by this opioid use crisis, and it remains a concern, really, because the vaping gateways to marijuana, the marijuana gateways to the opioids. So how do you feel? Well, how do you feel that dentists play a role in terms of protecting their patients and still manage their pain effectively, but do so in a manner that helps that person not become addicted or dependent, and also not get it out into the community, and where the community then suffers this opioid abuse?
It's actually very sad what's going on, and I see it over and over. And one of my dear friends, unfortunately, passed away because of it, the overdose. And I believe it started all by prescription drugs. So a lot of it to me has to do with communicating with the patients and explaining to them that, listen, some of the procedures that we're going to do, you will have some discomfort, you will have some pain. Let's have you meet somewhere in the middle. Take some ibuprofen, take some Tylenol, take some Tylenol 3, something very as low dosage as possible, without going overboard with it. It's worth it. We don't want you to get hooked on this. There's no need for overprescribing things that, listen, we're gonna expect some pain, we're gonna expect some some discomfort. So just hang in there, hang tight, talk to us if there's any problem, come in and see us. Maybe we can just, a lot of times just talking with them and explaining that, hey, you're going to be okay, the pain's going to be gone, they're going to be okay not doing it. If we really have to do it, give them something stronger. I usually give it not for like 7 days. I give it for like a day or two, and then just check on them again and see if anything else needs to be done. Generally speaking, we try to get to the patient when they have pain and start something on them right away. If we have to open the tooth and medicate it and start the root canal process, get it ready for the specialist, that way we don't have to give them something stronger. But if it's something out of our hand and the specialist truly needs to see them, as little as possible.
That makes a lot of sense, and I agree with you. Many times when they can just come into you and speak and allay their apprehension and see that what they're going through is normal, you're right. I think it's something that in our country we need to put back in, not just in dentistry, but really across the board, really in all our communities, because I think we're getting so much into marketing and the bottom line that there's no people involved anymore. It just seems like everything is another number and how quickly you can generate that number and go home. And there's no thought of, well, how about the people that were affected in those numbers, or how did you get to that number without including all these other people? So it's very interesting, because I wanted to ask you, as part of what I'm discussing now, is that I see that you really believe in educating. And, I want you to explain it. To me and for you, it's probably very simple, but for some reason it doesn't seem to occur. So I would love if you would take a moment to explain your philosophy and your feelings about what needs to happen with education, not just in your practice, but through our country.
Very good question, Doc. So it's just instilling a lot of those old beliefs, the family-oriented things, having the conversation, not hiding from the problems, just reaching out to the community, reaching out to the people around us, reaching out to our kids, to our staff, and make sure we have open dialogue, open communication with them. The more that reach is to our environment and to people around us, the less they're gonna, go by themselves and, take actions that they will regret later. They'll fall behind in life. They won't be as confident. They won't be in communication with their friends, and just communicating out there, just reaching out, make sure to as many people as we can, and keeping them engaged into positive environment, positive roles, positive discussions. We might not agree with each other, but at least we educate each other about other points of views, and keeping the dialogue going. The reason why my friend, unfortunately, we knew about his problems. When it went overboard is when he stopped acknowledging it, stopped talking about it. And as long as he was talking to us, we were able to help him. But when he said, no, I'm not doing it anymore, everything's great, maybe we could reach out more to them. Maybe we can keep them engaged. Same thing as educators, same thing as schools. Just be part of the kids' life, be part of their journey, and keep the sanity alive, keep the environment sane.
Yeah, what you're saying makes total sense, and I wanted to actually reference the U.S. Surgeon General's statement Dr. Vivek Murthy, MD, that he came out with 2 years ago, where he found that scientific studies were showing exactly what you just said, that the lack of social interaction in our country, and this is scientifically, not philosophically, based on scientific studies, was causing mental health illness, emotional illness, and, interestingly enough, physical illness of cardiovascular disease, heart disease, diabetes, dementia, and was actually equivalent, which is amazing to me to think about this. The fact of lack of social interaction was equivalent to smoking 10 to 15 cigarettes a day. And this is this, for those of you who are going to watch this program and say it's impossible, I reference you to go online to the Surgeon General, U.S. Surgeon General, crisis of loneliness and, sadness, loneliness, the crisis of loneliness and isolation in the United States of America, which is from, before we forget, because both you and I believe in education, I want to really acknowledge some people who have educated so many people. One of them, you and I both know Louis Colon down in Florida, who runs this great enterprise educating dentists across the whole country. The other one is actually the one that started me through Sterling Management. That was Greg Hughes, Dr. Greg Hughes. And another one who is a friend of mine, was a very jovial character, Majid Tabibzadeh, and with his brother Farid, who run this great company, marketing company, and really all three of them, all these men, all four of them actually, really educating all the time. What I wanted to ask you, because after your friend passed away, we started speaking, because there's a program called the Foundation for a Drug-Free World that's in about 18 different languages. It's free of charge. And, that you really want to do something with it as a dentist in your practice. What I want you to do is, why don't you explain to those viewers and those leaders that are going to watch this program, what can be done with this Foundation for a Drug-Free World program in your eyes, in your viewpoint?
Just getting as many of the staff members involved, getting as many patients involved, just sending the message, having the writing on the wall in the office, talking about it. And because no matter if your political views, Republican, Democrat, Independent, religion, it doesn't matter. You don't want your kids or family members or friends to be involved with that. None of us want that for each other. So just, getting that message out there as fast and as quickly possible to everyone, and getting more people to talk about it will reduce things. I have a very good friend of mine that runs the rehab center, and is a great patient, and he just opened more. And for example, I talked to him and I said, hey, we should definitely do something together, because if I have patients here that have any issues, I want you to be, help us out. And if you have anyone that needs any teeth work done, send them to me. I'll help them out. I'll be kind to them. We take care of each other. So they feel like there are more people that care about them, and they don't have to be lonely. They don't have to get attracted to things to calm their nerves or calm their pain. They can just do that with other people, with other groups, with other friends. Just keeping the dialogue.
That makes total sense. You've treated so many patients, but I was going to ask you, share some moments with some of the successes you had that come to mind with the patients that you've treated, and where they say, wow, thank you so much, Dr. Jamsheed.
So a lot of it come to my mind. I've had cases that people have been in dentures, and as you know, it's very difficult to eat with them. And it's always been in their mind that, hey, money is a big factor, and this thing's going to cost a lot of money, so I'm just going to stay with dentures. And we come up with a solution for them. We come up with a payment plan for them. And when they get those implants in there and just put those dentures on top of those, we usually don't see them for a while, despite us asking them, hey, come back, we need to check these implants. And they feel like they can eat, they're happy. That's one of the biggest things that I see, a big transformation for especially adults. For younger people, a lot of them have been teeth being crooked and never got a chance to straighten them. And I made it happen for them. I usually don't let money be an issue. We find a solution for it. Um, I had a patient that came in, and the mom was taking her daughter to Mexico to get the braces done, and the travel became an issue, and the gums were getting really inflamed. This is very recent, and the daughter was kind of crying, and I gave them a total cost. Um, I felt like it's probably too much for them all up front, and I said, "Listen, no matter what, I'm going to take those braces off. Your gums are going to be okay. And if we can make this Candid Invisalign, this is like Invisalign Candid Pro happen for you, we'll make it happen." And we came up with a solution together. And she had a huge smile on her face. We haven't even completed that case, but she's just happy, and she said, "I'm going to send all my classmates to you."
That's beautiful. That makes
And the
total
mom too. The
sense.
mom's like, "I'm gonna send all my friends to you too." And she happened to be I just remembered that she happened to be a dental assistant in the past. And she's like, "Yeah, I don't know of any dentist that would have done this for me, for my
Wow.
daughter."
Well, congratulations. Very well done. And when I want to ask you, because we're at the end of the show, what message would you like to leave to the community leaders out there, and for you and I, since we're both dentists, to our dental colleagues all across the country, even across the world? What message do you want to give those leaders?
Let's all work together. Let's make the planet a better place that we came to, because things are getting worse and worse. So whatever we can do as far as sticking together and keep the sanity, keep the conversation with our patients and friends and coworkers, um, because once things are better, once things are more sane, more people are going to get attracted to it. More people want to be part of good things. So just make it. Let's keep things together. Um, Keep the message uniform. Us as leaders, we should talk to each other more regularly. Have more of these podcasts. Have more conversations. Come up with more ideas on how we can keep our community motivated and safe.
Absolutely. I wholeheartedly agree with you. Thank you for being on the show.
Thank you, Dr. Fialkoff. Thanks for having me.
Oh, it's a pleasure. And for all of you who's watching this program, let's take Dr. Amir Jamsheed's example. We can do it everywhere, within the school system, as police officers, as trainers in different gymnasiums, as painters, mechanics, doctors, lawyers, attorneys, politicians. We have so much in our world. Secretary Kennedy said something that was really true to me. He says, we live like gods in today's world where we have so much. Let's appreciate what we have. On that note, we'll see you on the next episode of A Time for Truth show. Have a very good night.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. try to do your best, but only God knows that you've given everything you've got. The world takes you down. You just keep moving on. Let your feet